You're listening to an African Elements top news story for July 3, 2025. Please visit our website at africanelements.org for more daily news. Medicaid, a crucial program for low-income families, faces challenges from proposed work requirements that could lead to millions losing coverage. The Congressional Budget Office estimates that 7.8 million Americans would lose Medicaid under the One Big Beautiful Bill Act. A House spending bill could push an estimated 4.8 million Americans into being uninsured. In Michigan, 100,000 residents were expected to lose coverage in the first year if work requirements were implemented. These policies disproportionately burden vulnerable populations already struggling economically. The proposed reintroduction of Medicaid work requirements has been shown to lead to substantial coverage losses. Implementing these requirements is costly and complicated, often resulting in individuals losing health insurance even if they are employed or seeking work. Michigan's attempt to implement work requirements would have cost over $70 million, diverting funds from direct healthcare services. The state ultimately eliminated these requirements due to high costs and evidence against their effectiveness. Administrative complexity creates significant hurdles for states and beneficiaries. States with older eligibility systems may find data matching less effective, increasing administrative burdens. The need for effective engagement in work requirements adds additional financial considerations for states and managed care organizations. These costs divert resources from improving healthcare access and quality for Medicaid recipients. Despite claims that work requirements encourage employment, there is no evidence that they boost employment for Medicaid recipients. In Arkansas, the implementation of work requirements in 2018 did not increase employment. Instead, thousands lost coverage due to paperwork issues. The risk of losing coverage often stems from the inability to navigate complex reporting rules rather than from failing to work. The proposed reconciliation bill would require states to deny coverage to new Medicaid applicants not working at least 80 hours per month and terminate coverage for current enrollees who cannot document meeting these requirements. This creates a system where administrative burden dictates access to health care. Medicaid provides crucial coverage for low-wage workers, many of whom lack access to employer-sponsored insurance. Access to Medicaid promotes work, as healthier individuals are more reliable workers. The expansion of Medicaid and health insurance marketplace subsidies has significantly reduced the uninsured rate among blue-collar workers. Research indicates that blue-collar workers have gained health insurance coverage, cutting the uninsured rate by a third. Medicaid's minimal premiums and cost sharing make it a more accessible option for low-income workers. The current employer-based health insurance system leaves many uninsured, particularly low-wage workers. Nearly half of Americans receive health insurance through employers, but many low-wage workers are excluded. Employer-sponsored insurance often has limitations, including waiting periods and eligibility criteria that exclude part-time and gig workers. Low-wage workers may forego employer-sponsored insurance due to high costs. Medicaid work requirements mandate beneficiaries engage in a certain number of work-related activities to maintain coverage. The implementation involves complex reporting rules, leading to coverage loss for many. The proposed bill would require states to deny coverage to new applicants not working at least 80 hours per month, complicating access further. Individuals with disabilities often lose coverage due to a broken exemption process. The complexity of these requirements serves as a barrier to access rather than a pathway to employment. Losing Medicaid coverage can lead to increased medical debt and worsening health outcomes for vulnerable populations. A federal Medicaid work requirement could risk coverage for 36 million working-age adult beneficiaries. Community health centers could lose significant revenue due to patient coverage losses, with potential revenue losses of up to $32 billion. These centers are crucial for low-income populations, particularly in underserved areas. The proposed work requirements would also negatively impact older adults who cannot work but have not yet aged into Medicare. The economic impacts of Medicaid work requirements on states and providers are substantial. States face challenges in managing complex eligibility systems, and providers may experience significant revenue losses. The financial burden extends beyond direct implementation costs, affecting the healthcare ecosystem serving vulnerable citizens. Copyright African Elements.